Thank you. And good morning, everybody, for joining us today. My name is Carlos Crespo. I'm a professor in the Oregon Health Science Portland State University Joint School of Public Health. I'm Vice Provost for Undergraduate Training in Biomedical Research at Portland State University. I'm also a member of the Workshop Planning Committee. During the next session, we will be hearing from two speakers, followed by a facilitated discussion just like we just did now. Please type your questions in the chat box, and who would you like the question to be directed to? And we'll share them with the speakers during our question and answers portion near the end of the sessions. Full bios of our speakers are included in the meeting materials on the webpage for this event. And I look forward to a rich discussion. Our next topic is about data solutions. What we know about data is our friend. Data is very objective. In science, facts are represented with data. But we also know that data in and of itself doesn't change behavior. Like we just heard, the majority of our health problems, obesity, smoking, substance abuse, these are not exactly medical problems. These are not exactly problems that are solved with just data. These are community problems. They require systems level solutions. So in the next session, we're going to have the opportunity to learn more about how data can be used in major systems. We identify education and the healthcare system. But we also know there are emerging challenges in how we use data. Artificial intelligence, for example, is based on profiles. And these profiles could actually perpetuate intrinsic and extrinsic bias that existed before. We also know we're moving into precision medicine. And we have to ask ourselves, are we represented in these precision medicine models? We do know that there's overrepresentation and there is underrepresentation of racial, ethnic groups, body types in many of the clinical trials and biospecimen banks that are producing precision medicines guidelines. So we need to then identify solutions that are able to help systems make better decisions. At the same time, we also need to recognize the limitations of data. And we also need to be transparent about the assumptions that we make. A great philosopher of the 21st century, Dr. Anthony Fauci, said that models are as good as the assumptions that you make. So I look forward to hearing our next two speakers.